Today's COVID-19 numbers: 34 new cases in the community, including 4 that are currently unlinked.
How do you choose a mask that offers the best protection? We'll look at some of the do's and don'ts.
On the first day of home-based learning, parents share their top tips with us on helping children learn from home.
Welcome to The Big Story, coming to you live from the Straits Times newsroom. I'm Olivia Quay.
I'm Haryanto Diman. You can subscribe to the Straits Times channel so you never miss a single episode.
Singapore reported 34 new COVID-19 cases in the community today. 4 are currently unlinked.
The other 30 local cases are linked to previous patients, and among them, 28 were already quarantined.
4 imported cases were also confirmed today, including 3 returning Singaporeans or PRs. More details will be released later tonight.
Now we're happy to have Professor Teo Yik Ying with us. He's the Dean of the Saw Swee Hock School of Public Health at the National University of Singapore. Welcome back, Professor. Professor, it's been reported that the new variants are more transmissible. Does this mean there's a higher risk of transmission in transient settings, say for example like public transport, malls, or even more enclosed spaces like lifts?
Thank you for having me back. So it may perhaps be useful if we look at what does the phrase more transmissible actually means in terms of the mechanism of infections. It could actually mean that someone infected with one of these new variants will have a much higher viral load, or it could mean that the infected person remains contagious and infectious for a longer period of time. It could also mean that the coronavirus is able to attach itself better to the human cell, or it could survive better and longer on droplets, aerosols, and surfaces. And because of this, some of this mechanism, the risk of being infected by someone contagious with one of these new variants in the settings that we talk about in public transportation, malls, and closed spaces, particularly enclosed spaces with very poor ventilation, will definitely be higher now compared to the original coronavirus that we saw in early 2020, even if the degree of interactions that we have now could be shorter or less intimate.
Right. Well, Prof, the nature of viruses is that, it will mutate to spread and survive. So what's the possibility then that SARS-CoV-2, in trying to survive and become more transmissible, it becomes, airborne?
So I think, again, it may be useful to clarify what this statement of airborne transmission actually means. Because when we talk about airborne transmission in the context of the coronavirus, we are actually talking about the chance that within an indoor, poorly ventilated environment where the circulation of air is poor, the coronavirus can remain suspended in fine droplets or aerosol particles in the air such that the spread goes beyond the 1 to 2 meters of social distancing that we typically think about. But it doesn't mean that airborne transmission doesn't mean that when you walk about in parks or outdoor spaces, breathing in fresh air in an outdoor setting, that you can end up being infected. Equally, if you're indoors, if the ventilation is good with constant circulation of air, the chance of airborne transmission actually continues to remain low. Bear in mind that the main method of transmission is still through droplets and surfaces. So understanding the specific context of this airborne transmission is very important. So should we be worried about this airborne transmission? Actually, from the very beginning, we have maintained that indoor air-conditioned environment with poor ventilation are precisely the settings that allow the coronavirus to spread very well. So in this regard, our precautions, what we knew all along on mask wearing, social distancing, have always been there to guard against such modes of transmission. Coming back to your question on the evolution of the coronavirus, yes, definitely. The coronavirus is constantly mutating and evolving to better infect people in order to survive. Earlier on, I talked about the higher viral load. So the higher viral load right now is actually part of the mechanism that the virus uses to survive better by being able to infect people. And this constant evolution will happen regardless.
Professor, local authorities are investigating the possibility of airborne transmission happening in some settings here. We know that you mentioned a little bit earlier on about mask wearing and all that, but what additional challenges, if any at all, does this recent development pose to our pandemic management?
So I think there are two parts to this question. The first is what we've been talking about, what individuals can do to minimize their personal risk of infection if the coronavirus goes airborne and if it becomes the dominant mode of spread. The second is what it means for our public spaces, such as workplaces, our public transportation system, hospitals, and other healthcare facilities. So the implication of airborne transmission definitely pose significant challenges to public spaces because it means that there will now be a need to modify many of our indoor infrastructure and to upgrade ventilation systems, including how we filter air, our air filtration systems in buildings. So new ventilation, air quality, hygiene standards will need to be established to guide some of this implementation and assessment. So in the short term, these are some things that is going to be difficult to implement very quickly. So then it puts us to the next part, which is what can we do as individuals then to minimize our personal risk? And I think there's been a lot of comments around and guidance on how do we choose the right mask. And that becomes important because especially a mask that has multiple layers, where at least one of the layer is actually meant to be a filter, a filtration layer, or there's always the surgical mask. Second is really, when we talk about airborne, I mentioned look at natural ventilation, look at making sure circulation of air remains a viable option. So opening windows, relying on fans, those are very practical advice that I believe many homes can actually have. Workplaces may be a little bit more challenging, including public transportation. So then when in these places, it still comes back to some degree of distancing because the reality is that the closer we are to someone who is infected, the greater the risk to be exposed to a high concentration of particles, be it droplets or aerosols that we're talking about that contains the coronavirus. Maintaining the distance between people, we will be already lowering infection risk. But I think just to highlight, airborne transmission, if it really does happen often and easily, will challenge our assumptions that we have around social distancing. So I think that's something that we need to remember. But fortunately, having talked about all this, the main mode of transmission right now is still through droplets and aerosols from close contacts, especially when we're engaging in activities without our mask on. So making sure that we continue to practice the necessary mask wearing and social distancing etiquette will continue to go a long way towards protecting against infection.
Well, let's do a quick recap. Minister Lawrence Wong, he said yesterday that new cases will continue to be picked up before tapering off in about 2 weeks. So, Prof, how do you think the situation will unfold in the next fortnight?
So, firstly, I think it's right. We will continue to see new cases being identified. So the case numbers will be high. The community case numbers will be high over the next few days because we are casting our nets very wide now to perform more swab tests on people in a few sectors, including in hospitals, in the airport industry, and even people who have been to a few selected malls where we have a few cases being linked to. So when we perform more testing in the community, I expect we will find these cases that would otherwise have been missed because many of them could have been asymptomatic or mildly symptomatic. But I certainly hope the situation will taper off, especially given the enhanced restrictions that we put in place right now with the closures of dining facilities, dining eateries, outlets, working from home by default, and with home-based learning. So these enhanced restrictions are meant to reduce the degree of human-to-human interactions with the aim of trying to slow down the spread in the community to allow our contact tracing, our isolation protocols to catch up and once again stay ahead of the game of the outbreak. Now, if the number of unlinked cases reported daily continues to be high, today is 4 cases, that is good news, much better than what we have seen in the past few days. If the number of unlinked cases remain high, that is worrying because our protocols will not be able to keep pace with the outbreaks in the community. And that's a sign that we may need to tighten our restrictions even further. But I think as the ministers have mentioned, we will need some time to see whether our current enhanced restrictions will already be capable of breaking the transmission chain. And I certainly hope they will. Today, we have 4 unlinked cases, and I hope this trend continues to go downwards over the next few days.
Well, Professor, thank you as always for sharing your insights with us. That was Professor Teo Yik Ying, Dean of NUS's Saw Swee Hock School of Public Health.
Meanwhile, Singapore's Foreign Affairs Ministry has expressed concerns over the Delhi Chief Minister's claims of a new COVID-19 strain here.
In a statement, MFA said it's disappointed that a prominent Indian political figure had failed to ascertain facts before making such claims.
Foreign Minister Vivian Balakrishnan personally responded as well. Quoting the Delhi minister's original post, he tweeted, quote, "Politicians should stick to facts. There is no Singapore variant."
India's Foreign Minister S. Jaishankar sought to clarify in a tweet that the Delhi minister didn't speak for India. He also said Singapore and India have been solid partners in the COVID-19 fight.
Dr. Balakrishnan then tweeted a note of thanks to his India counterpart and said the focus should be on resolving the situation in their own countries and helping one another. He ended the tweet with, quote, "Nobody is safe until everyone is safe."
In light of the more transmissible COVID-19 strains and evidence showing that the virus can be transmitted through aerosols, you should choose masks with higher filtration capabilities.
So, which are the best types of masks? Well, here's what you need to know.
Well, of course, you can wear surgical masks or any of those given out during the nationwide mask distribution exercises. These include the DET-30 mask, the ProShield mask and the Living Guard mask. Cloth masks made of at least 2 layers are also okay, but you should stop wearing single-layered masks or masks with exhalation valves.
If you're opting for a reusable mask, what materials should you look out for? Well, it's good to ensure that the outer layer is made of polyester because it's a water-resistant material and can repel droplets from entering the mask. The inner layer of the mask should be made of a finely woven fabric to prevent respiratory droplets from escaping.
And with virus variants circulating, do you need to double mask? Nope, that's not necessary as long as you already have a good quality mask that properly covers your nose and mouth. But if you're in a more enclosed or crowded area, it would be a good idea to select a surgical mask or a double-layered cloth mask with filter inserts.
Home-based learning makes a comeback today as schools shut and classes are moved online. Well, a less than smooth start though, with some students having trouble accessing the Student Learning Space portal in the morning.
That's right, but the Education Ministry said the online system has since been restored to normal. Well, the Student Learning Space had also experienced similar issues in April last year, if you recall, when hundreds of thousands of students tried to log in for HBL.
All primary, secondary and junior college students, as well as those from Millennia Institute and special education schools, have begun full HBL, which will last until May 28th when the June holidays begin.
Well, 3 parents join us now to share their experiences.
Fariza Raziv, a medical social worker and a mother of 2, Shasi Kumar, a lecturer at ITE who also has 2 kids, and Jeremy Huang, who's a civil servant. Now his 2 children are in P3 and P1.
Fariza, let's start with you first. You know, it's your first time managing HBL for your son who's in primary 1. You also have a little girl in kindergarten. So how was the first day for you and your family, you know, getting used to these whole arrangements?
So for us, I think it's quite a difficult position because I have to work at work. I cannot work from home. So it was quite a lot of anxiety for myself and my husband. But we've prepped my son that we're going to do this, and we actually came up with a timetable for him to look through what he has to do for HBL. Yeah.
Conversely, Shasi, Jeremy, you guys should be pros now, right? Since, you know, your kids went through the same thing last year. Fewer teething problems this time around, we hope. Shasi, why don't you go first?
I guess so. I think if you want to call us the pros, I don't know about that. But yeah, we went through that last year, so we are more or less, you know, comfortable. I would say comfortable with the arrangement, and I think not all parents are have the luxury of having either one of the parents at home. So I'm on alternate weeks. I'm working alternate weeks. As for my wife, she's a teacher at MOE, so she's back home from today onwards, right? And yeah, she has got to handle the two kids as well as teaching her kids, her school kids on HBL. So she's got to handle that part. But from next week when I'm at home, then I can help her out a little bit.
Wow, more power to your wife there, Shasi. Jeremy, did you have a similar experience going through this whole thing the second time around?
Yeah, definitely. I think for now, for this year time, we are lesser problems. So what happens is that we get ourselves prepared. We set up our spaces. We get ready the laptops, the accounts all ready. 2 days before then 1 day before, the teacher sends us all the Zoom accounts. We get all the IDs, all the passcode ready and all that. So just to get prepared lah. Basically, it's and then basically what we faced last year, the challenges, we fix it up, and all that lah as well.
Farisa, I just want to go back to you because earlier on, of course, you mentioned that you can't work from home, and this is the first time as well that you're managing HBL for your son. You mentioned briefly that you've sort of put up a schedule or a timetable of sorts. If you could share with us a bit more on that, on other things that you have done as well, because on one hand you're managing HBL, and then on the other hand with work, and then maybe on the other side as well, your duty as a parent. Tell us more. How do you manage all these things?
Yeah, so it is really indeed quite a challenge. There's a lot of things, and it was very different from circuit breaker last year when I was at home, actually still finishing up my studies. So now that I'm back at work, the parenting part, I think my husband and I really need to be in sync. We need to know that we need to work together. Because he can work from home, he will be handling the HBL part in the day. So when I come home, I have to look through, make sure everything is done, cook the meals for the family. We've also had to discuss together whether to, because my daughter, she's actually in K1. We have to decide whether to actually send her to childcare. And we've had to make that calculated risk, actually send her to childcare so that, my husband can also manage his work from home as well as managing my son. So I think it takes two to work things around. It's not easy, but as long as I think both have this understanding, it makes things a little better.
Fariza, you have a child in primary school and also in kindergarten. Actually, out of the three of you here, all your children are pretty young because the oldest, I believe, is 9 years old. So guys, I just want to understand, do they know what's going on, why the schools are shut, and why they have to take their studying online, and are they even scared of this whole new normal that they have to get used to? Jeremy, let's go from left to right. Jeremy, why don't you go first?
All right, yeah, I think my kids, they enjoy this whole period. They can get to sleep late. They would have more freedom at home, so they can decide. After what they have done during the classes, they can decide what they want to do. They can ask permission and all that. So, of course, why is this happening? We have explained to them there are a few cases happening among young children within the schools. So they have a picture of what's going to happen. But in overall, they were quite positive for throughout this session. They kind of enjoy it. Yeah.
Farisa, what about yourself? How do you keep your two children informed of the situation?
I think it helps that I work in a hospital setting. So really engaging with them about talking about what's happening, about the COVID. Right now there's a spike, and that's why they have to shut schools down. I think it's hard for the kids as well as the parents. I think sometimes we forget that kids also go through a hard time, not being able to meet their friends, not being able to go through the normal routine. Especially for my son, he just started primary 1, a lot of adjustment, and then now back to HBL. In fact, yesterday my daughter actually, she cried before she went to sleep because she said that she wanted COVID to go away so we don't have to wear the mask on. So I think it's taking a toll on them, but As parents, I think we just need to, as best as possible, keep them informed, encourage them, and make the best out of the situation. Yeah.
Well said. Yeah, well said, Fariza. So, Shasi, how about you? How have you tried to communicate this whole pandemic or this whole, new normal to your children?
My boy is 9. My girl is 6. They're young, but I think they're old enough to understand. So we just speak to them and make them understand that they've got to be home and stuff like that, and HBL of course. But they are kids. They love to be at home. Like Jeremy said, waking up late and just staring the house down. That's what they do. They're kids, right? And we got to handle that part. But they've had the option. My boy has the option of going to student care. My girl, obviously, K2 is open. The kindergartens are open. But we had the luxury of having at least one parent at home. So we decided, no, let's be safe. They have to be at home. Yes, they got to finish the HBL. The little one has got to do a little bit of reading on her own. So we got to monitor that. So that's the hard part. But apart from that, like I said, it's better to be safe than sorry. And even if they tear the house down.
Well, we wish you all the best as well, with your family and this whole maneuvering this whole HBL arrangement, and of course for setting aside time to speak with us, Fariza, Shasi and Jeremy. Now, for those of you who are watching as well, if you're a parent, we hope you and your children are coping well with HBL.
Overseas, as Malaysia confirmed a record high of more than 6,000 COVID-19 cases in the last 24 hours, authorities are debating whether to impose a full lockdown. Social activities and travel between districts are currently banned under the nationwide movement control order, but the Straits Times understands that some quarters are pushing to ban all non-essential activities as well. A top official in a development agency said discussions are ongoing and that a full lockdown may kick in as early as Friday.
Back home, a National Library Board Deputy Director has been charged under the Official Secrets Act with leaking info on Phase 2 last June. Chua Wee Lin had allegedly shared details of the reopening to a WhatsApp group with 18 other members before the information was officially released to the public. Chua is out on bail and is expected to return to court on June 16th. If convicted of communicating unauthorized information, he could be jailed for up to 2 years and fined up to $2,000.
If you're looking to grab a quick bite in between meetings while working from home these days, how about an Impossible Burger, which from May 26 will be sold at over 300 7-Eleven stores. Served ready to eat, it can be warmed up in under a minute. Well, those are our top stories for today. For more news and videos, visit straitstimes.com.
And remember to subscribe to our YouTube channel by hitting the red button below. Once again, I'm Haryanto Diman with Olivia Quay. Thanks for watching The Big Story.